Are you tired of waking up with stiffness or ending each day with that dull ache in your lower back? Many people assume back pain is just a normal part of aging, but the truth is that everyday habits, the little things you do without even thinking, can quietly make your back pain worse. And if you don't change them, the discomfort can grow into something much more serious. Part 1. In today's video, we are going to uncover the most common daily habits that silently damage your spine and muscles. By recognizing these triggers and replacing them with healthier choices, you can protect your back and improve your quality of life. Before we begin, please remember to like this video, subscribe to our channel, and hit the notification bell so you never miss important health tips designed to help you age gracefully and stay active. Let's start with the first everyday habit that makes back pain worse: sitting for long periods without movement. Sitting may feel comfortable, especially if you are retired or spend more time at home. But staying in a chair for hours can be one of the worst things you do for your back. Here's why. When you sit for too long, the muscles that support your spine, especially the core and the lower back muscles, become weak and stiff. Your posture naturally begins to slump, putting extra pressure on the spinal discs. According to research from the American Journal of Public Health in 2020, adults who sat for more than 8 hours a day had a significantly higher risk of developing chronic back pain compared to those who sat less than 4 hours. Even worse, prolonged sitting was linked to higher risks of cardiovascular disease and early death. Think about how many hours you spend sitting. Watching television, reading, working at the computer, eating meals, even sitting in the car. It all adds up. Over time, this pressure compresses the discs in your spine and reduces circulation to the muscles that keep your back healthy. That's why you may notice your back feels stiff when you first stand up after sitting too long. Doctors at the Mayo Clinic explain that one of the simplest remedies is also the most powerful: movement. Standing up every 30 minutes, even for just a minute or two, can improve blood flow, release tension, and reset your posture. Gentle stretching or a short walk around the room is enough to make a difference, with proper cushions. And third, build small bits of activity into your daily routine. Stand while talking on the phone, do light stretching while watching TV, or take a 5-minute walk after meals. These small actions add up, and your back will thank you for them. Remember, back pain is not always caused by dramatic injuries. Often, it's the slow, everyday habits that quietly wear your body down. Sitting too long is the first bad habit we need to change if we want to reduce back pain and stay strong. We just talked about the first hidden habit that worsens back pain: sitting too long. Now let's move on to the second everyday habit that silently damages your back: poor posture while using devices. Think about how often you look at your phone, tablet, or computer. Most people lean their head forward, round their shoulders, and hunch over the screen. This position, sometimes called tech neck, places enormous stress on the spine. According to research published in the journal Surgical Technology International, tilting your head forward just 15 degrees increases the pressure on your neck to about 27 pounds. At 60 degrees, which is common when people look down at their phones, the pressure can rise to 60 pounds. Imagine carrying that weight for hours every day. Over time, it is no surprise that pain in the neck, shoulders, and lower back develops. Doctors explain that when the upper spine is misaligned, the muscles in the lower back have to compensate, which adds even more strain. This is why people who spend hours on their phone often complain of low back pain in addition to stiff neck and shoulders. A 2021 report from the American Chiropractic Association found that poor posture with devices is one of the fastest growing causes of musculoskeletal problems worldwide, especially among people over 50 who already have weaker muscles. The good news is that this habit can be fixed. Raise your screen to eye level whenever possible. Support your arms on a table to avoid slouching forward. Take breaks every 20 minutes to roll your shoulders and gently stretch your back. Small corrections done consistently can dramatically reduce pain. Now let's talk about the third everyday habit that worsens back pain: lack of core strength and physical activity. Many people think that rest is the answer to back discomfort, but in reality, inactivity often makes the problem worse. The muscles of your core, including the abdominals, obliques, and the deep stabilizing muscles near the spine, act like a natural brace that supports your back. If these muscles are weak, every movement places more strain on the spinal structures. According to a 2020 study in the Journal of Orthopedic and Sports Physical Therapy, people with chronic low back pain often had significantly weaker core muscles compared to those without pain. Walking can activate the stabilizing muscles without straining the spine. Over time, adding activities like yoga or swimming provides even greater benefits. The key is consistency, not intensity. Doing a few minutes every day is far more effective than doing nothing at all. So remember, poor posture with devices and weak core muscles are two hidden habits that quietly make your back pain worse. Correcting these daily behaviors will not only reduce discomfort, but also protect your spine for the long term. We have already covered 3 common daily habits that worsen back pain: sitting too long, poor posture with devices, and weak core muscles from inactivity. Now let's continue with 2 more habits that many people do not realize are harming their back every single day. The 4th everyday habit is wearing the wrong footwear. Shoes may seem unrelated to your spine, but they play a critical role in how your body carries weight. Unsupportive shoes, high heels, or shoes with worn-out soles all change the way you walk and stand. This misalignment travels up from the feet, through the knees and hips, and eventually puts strain on your lower back. According to a 2019 study published in the Journal of Foot and Ankle Research, people who wore unsupportive footwear were significantly more likely to report chronic low back pain. High heels in particular shift your center of gravity forward, forcing the muscles in your lower back to work harder just to keep you balanced. Over time, this leads to fatigue, stiffness, and long-term discomfort. Even flat shoes can cause problems if they don't have proper arch support, because the feet collapse inward and strain the spine. Doctors recommend choosing shoes that support the natural arch of your feet, cushion the heel, and keep your body aligned. For those who stand or walk a lot, supportive insoles can make a big difference. Remember, every step you take either protects your spine or stresses it. Do not underestimate how much your shoes matter to your back. The 5th everyday habit that makes back pain worse is ignoring sleep quality and posture. Sleep is when your body repairs itself, but if you are sleeping on the wrong mattress or in a poor position, your back never gets a chance to recover. Many people use mattresses that are too soft, too old, or do not provide adequate support. This allows the spine to sag and muscles to tense overnight. The American Academy of Sleep Medicine notes that mattresses should generally be replaced every 7 to 10 years, and medium-firm mattresses are often best for people with back pain. Sleeping positions also matter. For example, sleeping on your stomach forces the neck and spine into unnatural curves, which can worsen pain. Side sleeping with a pillow between the knees, or back sleeping with a pillow under the knees, are both recommended by physical therapists to keep the spine neutral. Another overlooked fact to inactivity: wearing unsupportive footwear, poor sleep quality and posture. Any one of these habits alone can increase discomfort. But when 2, 3, or more combine, the result is often chronic back pain that affects your daily life. The good news is that you can take control. By making small, consistent changes, standing up more often, adjusting your posture, strengthening your core, choosing better shoes, and improving your sleep environment, you can break the cycle of pain. Remember, your back health is not only about treating injuries, it's about preventing them through everyday choices. Back pain does not have to be an inevitable part of aging. With awareness and action, you can protect your spine, stay active, and live with less pain. Thank you for staying with us through this important discussion. If you found this video helpful, please like it, subscribe to our channel, and share it with others who may benefit. Your support helps us continue to bring science-backed health information to seniors and families. And always remember, the habits you practice every day build the foundation of your health tomorrow.